Hi, Mrs. Lewis. Thank you for coming in today. So we've been talking about cluster headaches. And what I want you to know right out of the gates is that cluster headaches have a characteristic type of pain and a pattern of attacks. The diagnosis depends on description of the attacks, the severity, the symptoms, the location. Generally speaking, the characteristics of the headache cluster that you have and when it happens, the onset, and so forth. So it's going to be vital that you keep a headache diary that starts to document the date, the time, whatever provokes the headache coming on, as well as how severe it is, the severity of the attack itself, the associated symptoms that come along with the attack, and also the location and duration. So we want to keep a good journal of what's going on here, and you're going to come back in, we're going to talk about that. Keep in mind that your health history and medical history are also vital components to building up a diagnosis for your cluster headache. Since there are no direct diagnostic tests that identify your disorder, diagnosis of cluster headaches is typically done by ruling out other types of illnesses or disorders. It's largely based on your history and the headache diary, as we've discussed. Your health history consists of the headache diary along with your existing health concerns. So we're going to do some diagnostic imaging, some CT scans, MRIs, magnetic resonance angiographies or MRAs, as well as lumbar punctures can rule out other issues that might present very similar to a cluster headache. Now, when it comes to hypertension, high cholesterol, drinking and smoking, we've talked about this, I strongly encourage you to begin smoking cessation, reduce your alcohol intake, get on an exercise regimen that's going to help you to lose a little bit of weight, and also formulate your diet appropriate with all the well-balanced nutritional elements that we can talk about a little bit more that's going to help you to live a more healthy lifestyle.
All right, Ms. Lewis, I'm going to tell you the background information on how these cluster headaches occur. So they're not fully understood, but what we do understand is that the vasculature in the brain becomes dilated, and that's pretty common with a lot of headaches. There's also a nerve that's been associated with these headaches called the trigeminal nerve, and when this nerve's stimulated, it causes a lot of the effects of the cluster headaches, especially with the tearing of the eyes and the nose. And there's also been found to have effects with circadian rhythms. So people who have issues with their sleep cycles often have cluster headaches. They've also found in mast cells, which are part of our immune system, that there's an increase of histamine that's released during cluster headaches. And there's also some genetic background. So sometimes when there's family members who have cluster headaches, other people in their family may also get them. A part of the brain called the hypothalamus, and specifically the back part of it, the posterior hypothalamus, is also shown to be activated during a cluster headache. So all of these different aspects are still being further researched on to find out why these cluster headaches occur. There's different triggers for different people, and they also are more common in men. They've also found in studies that cluster headaches are not as common during pregnancy, but if a pregnant woman were to have them, they would have to work with their provider to find out what medications would work, because many medications can interfere with the pregnancy. Speaking of the trigeminal nerve that I earlier discussed, the stimulation of that with different nervous system stimulation causes the nose and the eyes to be runny during the cluster headaches. And cluster headaches can last anywhere from 15 minutes to 180 minutes. They can usually occur for short periods of times, but some people have chronic cluster headaches and can go on for months. And a key aspect to these headaches is that they occur at the same time each day.
All right, Ms. Lewis, so I know that your cluster headaches are extremely painful, so we're going to talk about some medications and treatments that we can do today to take away some of that pain and some of the intensity that you may be feeling. First off, there is an acute treatment for an attack, and that is just delivery of oxygen through your nose. You would take a deep breath in and then out, and with oxygen through your nose, it's going to help with those cluster headaches. Second, we do have some medication. The first one is Emitrex, which you may have heard of before. It's used a lot with cluster headaches and people who experience migraines. You can get it in an injection, you can also get it in a nasal spray, or just a patch on your skin. This is the most effective if you do it right when you're feeling that pain. The second option is Vermipil, which is also for high blood pressure. So that's really good because I know you do experience some high blood pressure as well. And then finally, if you are really getting chronic headaches, you do have the option of getting brain surgery. It is invasive, and they do just do a nerve block. Along with these therapies, you can also do alternatives with your medications, such as acupuncture, relaxation, massage. So that is a great option as well.
So Mrs. Lewis, what I want to talk to you today is about some lifestyle changes that can help with your cluster headaches. Now we're going to talk about some triggers, some things that cause these cluster headaches. And the important thing I want you to remember is that these triggers only cause headaches during a cluster cycle. And what a cluster cycle is a period from your first headache to your last headache. Now cluster headaches usually occur without warning, without provocation, and they can sometimes have migraine-like effects. So some people, they think that they see an aura beforehand. And basically what an aura is you can have vision problems, zigzagging patterns, see, hear, smell things that aren't really there. You might have some weakness or even trouble and difficulty finding words or speaking. Now after this first headache comes on, what I want you to do is be aware of the triggers that can happen. And the two most common triggers for a cluster headache is alcohol, especially beer, and cigarettes. And with alcohol, your cluster headaches, you're a lot more sensitive to its effects, so even small amounts can trigger your headaches. So it's important that during a cluster period, you avoid alcohol. The cigarettes, same thing. You're going to cause headaches if you start smoking. So all I want you to do is I want you to quit, and if you're absolutely against quitting, I want you to at least stop smoking during a cluster period. Some other common things I want you to avoid or look out for: foods with nitrates. That includes bacon, preserved foods, things like that. So it's very important that you read the labels of your food. Now, before you freak out on me and say you can't have bacon anymore, they do make nitrate-free bacon, so you're good. The other things I want you to avoid are daytime naps, because this can interfere with your sleep cycle and just makes it hard for your body to stay healthy. Heat as well, hot weather, hot baths, hot showers, these kind of things can trigger your headaches. Some other common side effects: certain smells, bright lights, high altitude. So if you're planning on traveling and you're doing cluster headaches, just be aware that this can make things worse. Now everybody has different triggers, so not everyone's going to experience the same things. What's important for you to do is to keep a migraine journal and to write down what things trigger your headaches. So let's say, for example, I had cluster headaches, and during a cluster cycle I got a headache while making a video for my nursing school class. So what I would do is I would write down in my journal that making videos for nursing school gave me a headache, and I would try to avoid that during a cluster period.